Joining me right now is Dr. Tambar, rheumatologist specialist. Welcome and thank you for being on the show.
It's my pleasure.
And again, Dr. Tambar is with Advocate Illinois Masonic Hospital, one of our rheumatologists. I want to start by opening, Doctor, that we know that significantly, while as many as 1.5 million individuals in the United States have been diagnosed with rheumatoid arthritis, over 20 million people have been diagnosed with osteoarthritis. What is a we know what a rheumatologist is pretty much. You treat arthritis, osteo, and all those things. But osteoarthritis, that's not something you hear a whole lot about. I mean, you hear rheumatoid arthritis, you hear about, but osteoarthritis?
Right. So, over the last 10 to 15 years, there have been a lot of dramatic improvements in the treatment of some types of arthritis, like rheumatoid arthritis, to the point where, we can actually prevent the damage that happens in these conditions. Osteoarthritis is a condition that is, called wear and tear arthritis, and unfortunately has not really gotten the same kind of research as rheumatoid arthritis and some other conditions has over the years. With that said, even in the year 2009, with the current medications and the current treatments available, osteoarthritis is a condition that is much more treatable, not only from the perspective of pain relief, but also improving functional ability as well. So why don't we hear as much about it?
Right.
It's a strange thing because realistically we'll all get it at some point if we live long enough. And you're right, it's the leading cause of disability in our society as well. I think as people in our society have higher expectations of the quality of life that they want to live as they get older, I think medicine is catching up to that as well, and we're just starting to get better treatments for those conditions as well.
Now, I know that chronic pain in the joints is a common problem for many people with arthritis or osteoarthritis. In fact, it's estimated that at least 1 out of every 3 American adults suffer from some sort of chronic pain in their joints. So, if they're suffering that, and if they're looking at those things, and they're seeing that the pain is coming and it doesn't go away, what should they do? Put on heating pads, take a Tylenol, see a doctor?
Right. I think I think there's some basic things that you should think about when it comes to your arthritis pains. The first thing is that if you have significant pain that's not relieved with basic over-the-counter meds, or if you have significant pain that's causing functional impairment, that's a significant amount of pathology. In which case you probably should present that to your physician or to a specialist that treats that. So I would say from a really basic standpoint, if you're not having sufficient pain control, or if you're having significant functional ability loss, that's when you should be presenting to your doctor.
Right.
In terms of what kind of things can patients do on their own before they present to a physician, I'd say some really basic things. Over-the-counter meds like ibuprofen are fine. They help mask the pain. I think exercise is a really key thing, not only in terms of weight loss, it's also good in terms of keeping your muscles strong and also helping with range of motion as well. And I think basic nutritional aspects are also important as well. If you eat a healthy, balanced diet, you basically stay healthy overall, and that applies to not only your heart and other parts of the body, but to your joints as well.
And that's so important. You look at health and you think that, if I eat well, okay. But if you really eat well and take care of yourself and exercise, it really helps, as you mentioned, the overall health of oneself.
Right.
It's the whole thing, the whole body. Now, for those viewers who are just joining us, our lines are open. If you have any questions for Dr. Tambar, please call us at 312-738-1060. The number's in the bottom of your screen. Our lines are open. Now, natural remedies for rheumatoid arthritis. Are there really any natural remedies for rheumatoid arthritis?
There's actually one study that has shown that using omega-3, which is a supplement you can find in a lot of natural foods like fish, like nuts, like flaxseed oil. You can also find it in nutritional supplements over the counter. Has been shown in rheumatoid arthritis to actually help with pain as well as swelling and function. The main issue for a condition like rheumatoid arthritis is that it's not just a matter of pain control, it's really a matter of long-term functional ability maintenance. And the newer medications that are available on the market these days that a rheumatologist will use can really flat out control the disease in a rheumatoid arthritis patient to the point where patients' pain is not only controlled, but they really don't develop the kind of debilitating arthritis that they used to in the past.
Now, I know that a lot of times with rheumatoid arthritis, patients do feel that, if they're suffering from joint pain, obviously they're going to be fatigued all the time and they're going to be dragging and tired, and sometimes it's really hard for them to even get exercise. For someone in that condition, what would you recommend as far as aerobics or exercise at all?
Right. I think low impact activities are always good if you have arthritis. Things such as water aerobics or biking. I think for patients that are pretty fatigued or have a lot of disability, I think starting slow and slowly building up is really the way to go. Frequently I'll work in conjunction with physical therapists as well, and I think working with someone you can trust in that manner to slowly build up your exertional tolerance is really the key. But the key is really to not let yourself fall too far off, that you need to constantly keep yourself active for sure.
All right. Well, we do have a caller. Caller, you're on the air. You have a question for Dr. Tambar.
I'm calling to ask a question in regards to my leg. I've been to several doctors, and the pain starts at my hip, and it goes all the way down to my feet, and my feet get numb and a tingling feeling in it, and the doctors haven't told me what it is.
It sounds like that's a real problem. I think the evaluation for anyone that has pain or disability requires a few different things. Certainly listening to your story and how you're describing your symptoms. In addition, a really careful exam, and as well as evaluation of whatever labs or imaging studies you've had done can really help in making that diagnosis. It's hard to say just hearing what you're describing. If I can sort of pull out a diagnosis, it's hard to do that. But I'd say that if it's significant symptoms that you're having, certainly you should get that checked out.
Possibly too that if your doctor is not giving you a response, you might want to consider a second opinion.
Oh, okay. Thank you so much.
Thank you, caller. Good question. A lot of times when you have a physician who you go to and you don't see and really doesn't get back to you, doesn't give you the answers, or any answer for that matter, it's you might want to consider a second opinion, regardless of where you go. If you're still waiting and you need something to be told, you want to know what's going on, definitely get a second opinion if your doctor's not getting back to you. We talk about wear and tear arthritis. Now, I've heard that term a few times. I'm not sure what it is. Can you tell us what wear and tear arthritis is? Right.
So essentially with time, just chronic stress on your body just from daily living eventually causes some wear down of the cartilage and the buffer between your joints, between the bones. What osteoarthritis or wear and tear arthritis is basically that sort of progression over time that eventually causes pain and disability. That's really what osteoarthritis is.
Okay, and so, what are some of the treatments for osteoarthritis?
Right. So, from a patient standpoint, things that you can do include losing weight, staying in shape. In addition, doing a really regular exercise routine helps. There's some over-the-counter products that are helpful. I'm not really a big fan of glucosamine chondroitin because the studies out there really are pretty, they're really not that positive for it. But it's fairly harmless, and I have patients that say that it helps. I think if that's insufficient, the other things that physicians can offer you are, on one hand, there's pain control with certain types of medications or as well as injections. Some of the newer medications out there, including injections, can give you longer lasting pain relief going on for months on end. Something that's a relatively new idea in medicine in general, but certainly the treatment of arthritis, is the concept of regenerative medicine. The idea being that if you have damage in a part of your organ or part of your body, can you actually have the body help to regenerate itself? In patients who have chronic tendinitis, there's actual evidence that if you take a sample of blood from a patient, mix it down so that you take the portion that has a very high percent of growth factors and inject that into a diseased tendon, you can actually help repair that tendon. It's a pretty exciting idea because it's it's essentially safe because you're taking a patient's own blood. I think the keys here are if your physician, number one, believes in the idea of regenerative medicine. It's still a relatively new idea. And in addition, if you're actually able to target the area that you're trying to repair accurately. I think the future of medicine, certainly for degenerative conditions like arthritis, is really going to be in regenerative medicine.
Right.
And I think we're just starting to get into that. This is actually a technique that's already been used in certain athletes already. I think Heinz Ward had it used in his knee before the Super Bowl.
Oh.
The idea now is that we're just starting to use it in the general population as well. Partly because it's an available treatment, but also because I think all of us have higher expectations now, and our expectations are that we want to continue to live not only pain-free lives, but also really active lives, lives where we can continue playing the sports that we've grown up playing, and continue being active with our family and our kids. So I think as our expectations improve, I think we'll get more and more better treatments.
We got time for one last question, and we'll answer it. Caller, you're on the air.
Yes. Yes, hello?
Yes, go ahead.
My question is, when you have fluid around your legs,
When you have fluid around your leg?
yeah, around the kneecap and your ankles,
All right,
what can you do about it?
all right, we'll answer that for you, okay? Thank you.
Right. I think it depends on why you have the fluid around the leg. If you have the fluid around the leg because it's due to an arthritic or tendonitis condition, there's really specific ways to treat that depending on what the cause is.
Right.
On the other hand, if you have fluid around the leg that's due to a completely different issue like your heart or kidneys, that's a whole different issue. It really depends on all of that.
All right, well, our time goes by so quickly. I mean, we can sit here and keep talking, and Dr. Tambar and Dr. Yajnik, thank you so much for coming on the show today, and we hope to have you both back. So on behalf of my colleagues at Spinal Care at Advocate Illinois Masonic, Dr. Tambar, Dr. Yajnik, we want to thank you for allowing us to share this important information with you on prevention healthcare as it relates to arthritis and cancer. Again, if you're calling, call Spinal Care, call the 1-800-ADVOCATE number to register for the upcoming events, free events. Again, my name is Lucy Aquino, and I represent Spinal Care, a program of Advocate Illinois Masonic Hospital. Stay tuned. There's a lot more information coming up next. Good evening.